Excuse me, ladies and gentlemen, we now have our speakers in conference. Participation in this presentation is by express written invitation of the AHA only. Unauthorized participants or in any party that aids and abets such unauthorized participants may be subject to criminal or civil penalties under both state and federal law. Please disconnect from the call or log off the webinar if the AHA did not expressly invite your participation. Please be aware that each of your lines is in a listen-only mode. During today's presentation, we will open the floor for questions or comments. At that time, instructions will be given as to the procedure to follow if you would like to ask a question or to give a comment. It is now my pleasure to turn this conference over to Sun Cao. You may begin.
Thank you, Chancel. Thank you, everybody, for participating in today's Lunch and Learn webinar, Legionella, Waterborne Pathogen Risk Mitigation, a Comprehensive Approach. Today's Lunch and Learn webinar is sponsored by Watts Water Technology Incorporated. The webinar is being recorded and will be posted to ASHI On Demand Learning page. All participant lines are muted. If you have any question during the webinar, please type your question in the chat box, or we could take your question live over audio at the end of the webinar. Today's webinar speaker is Jana Sumi. Jana, would you like to introduce yourself and kick off the webinar?
Sure. Thank you very much. My name is Jana Sumi. I am the Healthcare Market Manager for Watts Water. Watts Water is an international plumbing manufacturer and water quality manufacturer. In regards to the presentation today, I would estimate that Watts manufactures approximately 90% of the solutions that you would see going from point of entry to point of use in a premise plumbing system in a hospital. And today that's exactly what we're going to talk about, which is Legionella and also other waterborne pathogens. You should keep that in mind as you go forward and are trying to figure out what's the best solutions for you as far as Legionella. It's not the only waterborne pathogen out there, and sometimes what we might do and what might work for Legionella risk mitigation might actually negatively affect the proliferation of other waterborne pathogens. We're going to start today by very briefly just doing a little bit of education about Legionella in case someone does not know, but the most of our time is really going to be spent looking at different solutions and different design methods to help mitigate that risk. You can go to the first slide. So Legionella 101. Like I just said, Legionella is only one of many waterborne pathogens. Legionella is kind of unique, though. You can't completely kill it. There are some people in the industry that might debate you on that. But basically what I mean by that is you can kill it in one space within your premise plumbing system, and it has the ability to come back later down the road. So it's very unique in that. It's also very unique in how somebody would catch Legionnaire's disease. You would have to aspirate or basically breathe in the Legionella. For example, you could be in a shower and you would breathe in the mist that's coming off of the hot water that's coming into the shower. You could do that from faucets, from water fountains, spas and hot tubs, and even ice machines. There have been cases where patients in a hospital have gotten Legionnaires because they were on an ice-only diet. There was Legionella within that ice. They started chomping on the ice. They got choked up, and they inhaled part of that Legionella. So it's very comprehensive in how it can spread and affect humans. Anybody can get Legionnaires, but people who have immune-compromised systems, such as people who are a bit older, maybe they are a smoker, or they have underlying medical conditions, are at a higher risk for getting Legionnaires. I would also note that really anybody is susceptible to this, and the fact that our country is very heavy in the use of antibiotics also plays an effect because it loosens or restricts our ability to fight back against the disease. Next slide. So just some quick numbers about Legionella. I'm sure if you've been paying any attention to headlines this year, you would see case after case after case of different Legionnaires events happening across the country, whether that be in hospitals and hotels, such as the one in Atlanta. There's been an outbreak at a fairground this year. So that we continually see those breakouts occurring. Between 2000 and 2014, the CDC reported seeing a 400% increase. And we estimate, and it is an estimation, about 25,000 cases per year. The reason that that's an estimation is we really don't know how many cases there are out there because of two different things. One, a person could be admitted to a hospital or already in a hospital and get pneumonia, and it's not connected to Legionella. And or the fact that most of Legionnaire's cases actually are sporadic. They aren't what you would consider an outbreak. And an outbreak is any place where there are 2 or more people who have been confirmed to get Legionnaires from a specific place. However, like I said, many more cases are actually sporadic, so somebody could actually be getting it from their home or any other place, but it's not technically reported because they don't know about it, or it's not reported because it's not an outbreak. It's a very serious disease because 1 in 10 people approximately will die if they get Legionnaires, and if you do survive, you live with complications and your lungs being damaged for the rest of your life. Next. A few more numbers on the cost of Legionella and some other ones as well. 6,100 cases recorded in 2016. Like I said, 1 in 10 will lead to death. The approximate cost per patient in a hospital is about $38,000. I think most people would say that that's very underestimated. Legionella is the #1 cause of waterborne diseases outbreaks in the United States. And again, that's important because there are other waterborne diseases that we need to be looking at. We are starting to see an increase in litigation in regards to Legionella. I believe the highest award has been $5.2 million. And overall, the cost of Legionella is just skyrocketing. Waterborne illnesses, including Legionella, led to over 40,000 hospitalizations with an annual cost of $970 million, and that includes $430 million in Medicaid and Medicare expenses. Then if you add on employee work time and productivity costs, you get up to the $1 billion mark. So it's a very costly disease, both in the protection of life and then also the cost of it. Next slide. Current regulation. What you will find in the industry is there's actually quite a few comments, statements, guidelines, etc. that are regarding Legionella and what you should or shouldn't do. And you'll see a list of those in a little bit. However, the CMS mandate is really the only one out there that is enforceable. So that makes a big difference. The CMS mandate is based off of ASHRAE 188, and it's enforceable because if a hospital does not comply with it, they could actually risk losing their Medicaid and Medicare reimbursements. So we have seen a rush of hospitals starting to conform to this. It's important to note that the mandate does not give guidance or instructions on what types of solutions, how or when testing should happen, etc. There are other entities out there, including ASHRAE and NSF, that are working on additional guidelines that would be enforceable. So we'll see where that goes, but that's still several years off. But again, CMS mandate, what it basically does, and you can go to the next slide, it requires a hospital to assemble a water management team. And the other requirement is to have a water management plan. So what does that really look like? A hospital needs to assemble a team. And generally that team is going to be made up of someone from infection control, maybe a facility manager, someone from engineering, There needs to be somebody from administration that has the ability to make decisions about water, or not about water, but about money, excuse me. You could have a water treatment provider on that team, and you might even have an expert on Legionella outside of the hospital come and participate on that team. What you need there is expertise from several different areas in that hospital that all touch the requirement or the need to mitigate the risk of Legionella. So once that team is put together, you start working on your water management plan. And the basis of that is mapping your premise plumbing system. Sometimes people think that sounds like a really easy job to do. Other people immediately go, I have no idea how I'm going to do that. A premise plumbing system in a hospital can be very complicated. It can have changed many times over the years as buildings get renovated and they start being used for different things. So take that very seriously and make sure you get an accurate map of your premise plumbing system. Once you have that map down, you need to identify your areas of risk for Legionella. So you need to go through that plumbing system and identify if there's certain patient rooms that are at a higher risk, if there are ice machines that are at risk, any place within that premise plumbing system where there could be a risk. And then for each of those risks, you establish a critical control point measurement. So for each of those risks, you decide, okay, this is the parameter, and if it goes over this parameter, then we have to do something about it. And you have to also include in that plan what you're going to do about it. So you've assembled your water management team, you've mapped your premise plumbing system, you've identified your risks, and you've established your critical control points. From there, you monitor and you take planned corrective action. After you monitor and things change and you go on, you want to make sure that you document everything that you're doing. You want to document the original plan, you want to document any changes to it, and you want to document any of those control points that have gone over and how you reacted to them. And you want to evaluate the plan. This is a living document. It's not a plan that you create and sit on a shelf and then maybe look at every once in a while. This is a living document that you should be meeting on a regular basis and examining and evaluating. Next slide. So again, I've already mentioned a couple times that Legionella isn't the only one out there that we need to be concerned about. This represents kind of what some people in the industry refer to as the dirty dozen. So you can see there are lots of other bacteria out there, many of them being waterborne pathogens. Again, the importance of this is that we have to consider them when we choose solutions and design decisions, because sometimes what we decide for Legionella might actually not work or actually hinder mitigating the risk of another waterborne pathogen. Next slide. So the premise plumbing system, what does that really look like? Well, this is an illustration from source to tap. So it starts with the water utility, the water coming into your building at that main break, and certain concerns that you should be looking at that junction is the disinfectant level. Many municipalities are going to put a disinfectant in that water that's coming into your building. It's good to know what that is, but it's not good to rely on that disinfectant in the areas of mitigating the risk for Legionella. There's many reasons for that. There are water main breaks that disrupt the levels. There could be service disruptions, whether that's planned or not. The distance to the building. How far does that water have to travel to get to your building, and how much is that disinfectant dissipating as it travels? And then also the age of the water. Water can get old, and that causes other problems that we need to be aware of. So the water's entered the building, and now we're in the building maintenance room, which we would still consider the point of source. Things that we need to look at there and ways that we can mitigate risk starting in that point of building maintenance room is the temperature of the water, scale reduction, UV, chemical dosing, copper, silver. Those are what I would say are considered the most prominent solutions when looking at mitigating the risk of Legionella. So we move along from the building maintenance room, and we are now in the premise plumbing system. So even though we might have put in solutions in that building maintenance room, it doesn't mean you're not still at risk as that water moves through the premise plumbing system. You need to be looking at the age of your piping, the material that your piping is made of. You need to look at if there's scale buildup inside, if there's biofilm buildup. An important one that's very hard to deal with are dead legs. Sometimes they're unavoidable. Sometimes they've been there for a long time. You need to know where they are so you can act appropriately. And again, water stagnation. Maybe it's not a dead leg, but maybe there's some place that that water is slower to move through, or it's sitting, so that water stagnation can cause a proliferation of growth for Legionella. So now we've gone through the premise plumbing system, and now we're to the point of use outlet. What concerns should you have there? Again, the age of the water. Is there stagnant water coming in? What's the water flow? What we're finding is some of the regulations that we've put in concerning conservation of water are actually hindering or hurting the proliferation of Legionella. So we need to know what that water flow is. We need to look at how our sinks are designed, and we need to look at the shower hoses. Also, those ice machines that we looked at. If you do have a water fountain on your premises, I would get rid of that. And then you go to the patient and victim. And often we don't talk about the patient and victim that much in educational things like this or at conferences. And I just want to point out that all the decisions that we make should really have that patient or victim in mind. And I would say that I have a better appreciation for that. My mother, a few months ago, was notified that she was put at risk of getting Legionella when she was getting chemo. So I saw a different side of it. She did not get Legionnaires, so I'm very happy and fortunate about that. But it did definitely give me a different point of view and reminds me to always put that patient and victim within your planning. Next. So how do you mitigate risk? We just talked about a few things. You need to keep in mind no matter what, and if you take one thing away from this presentation, this is what you should take away. Not all solutions have pros and cons, and one solution is not the answer. There isn't a magical solution out there that's going to 100% mitigate your risk of Legionella. And all of those solutions have different pros and cons, and which one is better for your building might be different for somebody else's building. You need to look at considering a multi-barrier approach, and that's from point of entry to point of use. So that means I'm going to have multiple solutions at different points in my premise plumbing system so I can mitigate that risk in different areas. So even if that Legionella grows back or grows more as it's traveling through the premise plumbing system, you have something in there that's going to help mitigate that risk. And again, we just said some of the types of solutions on the market. We mentioned heat, copper, silver. We didn't mention point of entry ultrafiltration. There's also UV, disinfectants, and point of use filters. So we're going to talk a little bit about design, and then we'll take a closer look at those solutions. Next. There are a lot of design considerations that you should be looking at. And this is whether you're already in an existing building or you're starting construction on a new building. These are the things you need to be looking at. So it's broken down into 4 different areas, the first being water. Again, how old is your water, and do you have areas of stagnation? What's the temperature of your water? Do you have lukewarm water? Is that temperature going down and fluctuating quite a bit as it travels through the premise plumbing system? You need to know about the disinfectants that are in your water or you're putting in your water. How strong are they? Are they within government regulations? And how much is that dissipating as the water travels? The pH level, we need to look at that too, because some solutions out there work very well in any pH level, but a lot of them have sensitivities to pH levels. The low flow rates, again, look at those, if you have sensor faucets or certain things that you're doing to lower that flow through the faucet or the shower, you need to be aware that that might have a negative effect on Legionella. Design. So when you're designing that premise plumbing system or you're in a building and you're looking at how your premise plumbing system is designed, again, dead legs. That's probably the number one thing if I ask an infection control professional or a facility manager what their biggest concern is, and almost always they will say dead legs. Dead legs is what keeps them up at night. You need to consider the complexity of the plumbing system. Again, the plumbing systems within a hospital can be very complex. You need to look at construction. So you need to be aware that whether you're starting a new building, so for example, if you're building a new building in construction, one of the first things that goes in is water, but it just sits there. And it sits there, and it sits there, and it sits there. And that's a perfect place for Legionella and other bacteria to grow. When the building is eventually ready to open, you need to make sure that you've taken all the precautions necessary to make sure that you're not opening a building that's subject to Legionella. You also need to know that during construction, so for example, if you're in a building, you have different construction projects going on in that building, you need to realize that that could increase your risk for Legionella because you're probably going to have to shut the water on and off during that period, so those disruptions can increase your risk. The other one, look at the construction going on around you. Are there buildings, even though they're not yours, are there buildings close to you that are having construction projects going on? That can also increase your risk. You need to look at your piping size and your piping materials and make sure that those are appropriate. You need to look at how your water is circulating. Is it constantly circulating? That's the best formula in regards to mitigating the risk of Legionella. Again, different considerations for whether it's a new building or there's a renovation. Water heaters. Do you want to go with a tank or no tank system? There are good and bad things about both of those. And how are you going to control that temperature of the water? And we would definitely recommend a digital mixing valve for that because it gets the most precise control. And then look at the type of facility. Are you a general hospital? Are you a long-term care facility? Are you a specialty hospital? All of those things should be considered because the risk of your patients could be different in those different scenarios. The third thing, bacteria. Again, what does your biofilm look like inside of your pipes? And what are you doing to try to lower that biofilm? Do you know you have a presence of Legionella in your piping system and your premise plumbing system? And if so, what are you doing about it? Water main breaks and disruptions can increase the amount of bacteria in the premise plumbing system. Scale and sediment can also create an environment where bacteria grows. So again, what are you looking? What does it look like right now? What do you have? What bacteria and pathogens are you monitoring? And are you testing? If you're not testing for Legionella, I would strongly encourage you to do so. I know in some instances there's still a mentality of if I don't know I have a problem, then I don't have a problem. And I would try to stay away from that and just be proactive and test. So you're being proactive, you know what you're dealing with, and you can make sure that the occupants in that building are safe. The last design consideration are the guidelines and standards. You can see a list there, and I mentioned earlier that there are actually a lot of guidelines and standards. So you need to take a look at that, see which ones affect your states and how you can apply those guidelines and standards and what you have to do as well. Next slide. So now we're going to start looking at the solutions. Heat is probably, heat and disinfectants are the #1 and #2 solutions that are regularly used. One of the reasons is you're probably already doing those two things in your building, whether it was for Legionella control or not. Controlling the water temperature can be very effective at killing Legionella. It can kill very quickly. ASHRAE 188 recommends it. It doesn't necessarily address those dead legs. So even though you heat up your water in one place, if that water travels and then it goes to a dead leg or it goes to somewhere where it's sitting, then that Legionella can grow back. You always have to have a concern for scalding. So what are you doing at point of use to mitigate the risk of scalding? Sometimes the energy can be high, depending on what you're running that system at. Typically at around 140 is what a lot of people do. You need to know that the temperature control does not penetrate slime or biofilm. So if you've got bacteria growing in that biofilm, the hot water might not necessarily help you there. The other thing to think about is how effective is your system for controlling the temperature. The new digital mixing stations such as the IntelliStation can control the water temperature between 1 and 2, plus or minus 2 degrees. So knowing that that's monitored and very precise is an important thing to do. I'm sure you guys probably already know this, but how water temperature affects Legionella. Below 68, it's dormant. 68 to 122, that is like the party zone. They're growing, they're having fun, and they're thriving. Once you reach above 122, they survive but don't multiply, and then as you go from there, the Legionella will start dying more quickly as the temperature rises. Again, temperature control, we would recommend digital mixing because it gives you the most precise control on temperature. It also has the ability to purge your system. So if you're, you know you've had a breakout or you know there's an issue within your premise plumbing system, you can quickly increase that temperature to a rapid kill. And there are many other reasons, but those two are very strong as far as Legionella goes. You can also control your temperature with your water heater. I mentioned tank or no tank before, which is a decision that has to be made. And either one is fine. Either one will work. Some things that you should consider are, is there possibility of scale or biofilm or sediment building in that water heater? If so, what are you doing about it? Also be aware of disruptions in your water system because that can affect your water heater as well. What that water temperature is needs to be monitored, and the important thing there is to make sure it's the same temperature throughout that tank. There can be variations, so that's something to keep in mind. Next slide. Disinfectants or chemicals. It's interesting, chemicals in the States are used quite often. We seem to have a familiarity with them and a higher comfort level. If you go to Europe, you'll find that they don't like using chemicals. They try to mitigate the risk of Legionella through other factors, but different chemicals can definitely be effective against Legionella. Chlorine is probably the most widely used. Again, pros and cons on each of these that you should be looking at. All of these are chemicals. They can have different effects on the water taste, the color. There could be human health reactions to them. And some of these work better in biofilms, and some of them do not. Some of them penetrate that biofilm, some do not. As you see, chlorine does not. penetrate that biofilm very well. So you might be killing the Legionella that's free-flowing through the water, but you might not be getting to that anything that's hiding in that biofilm. Monochloramines are probably the next, after chlorine, the next chemical that is used the most often. Again, they've been proven to work very good on mitigating the risk of Legionella. Monochloramines can penetrate that biofilm better, but it oxidates slower than chlorine. So again, the reason that you have to look at all of these solutions and the pros and cons and be very well versed on your premise plumbing system is because there is not one answer or one solution that's going to take care of it. So again, look at the pros and cons of each of these. Other disinfectants or alternatives to disinfectants, UV is used by a lot of people. It has been proven to kill Legionella. It basically disrupts the DNA where it can't repopulate. And so a lot of times you'll see a UV product in that maintenance room, and sometimes even two different ones on before circulation and on coming back as well. Copper silver is another very popular choice. It has also been proven to be very effective. Some of the negatives possibly to copper silver is the cost. It can have an upfront cost, and then you have upkeep costs as well. You have to be registered in the state to be able to use that and to be able to maintain it. But again, these are choices that you should be looking at. Next slide. Point of use filters. You hear a lot about point of use filters, and obviously they can be a great choice as a last line of defense. What we're seeing in the industry is that point of use filters are being used on faucets and shower heads. They can be used in patient rooms or in public bathrooms, etc. You need to know about the replacement of those. How often do you have to replace them? Every manufacturer will have a different guideline on when you have to replace those. You also have to be aware and know if those point of use filters are clogging up at all, because if they are, then the rate at which you need to change them might be different. What we find most in the industry right now is that if a hospital has a breakout, a lot of hospitals will automatically go in and put the point of use filters in, especially until they're able to figure out the true source of the Legionella. And we're also looking, and I think what you'll see going into the future is having those point of use filters in high risk areas in hospitals, no matter if there's an outbreak or not, they're going to be there all the time. So in your ICU and your NICU, et cetera, I think what you're going to see is those being on the sink, the faucets, all the time. Point of entry ultrafiltration, again, this goes back to the maintenance room. It's an option for you. A lot of hospitals are already going to have some sort of filtration, that you need to make sure that the filtration for Legionella is there. That's the most important thing to do because it's a very small micron, so you have to make sure that you have the appropriate filter. Next. Scale reduction. Scale in and of itself, if you reduce that scale, it's not going to have a direct effect on Legionella or any other bacteria. However, I always stress that scale reduction can help aid in mitigating the risk of Legionella, because scale essentially in that pipe can serve as a food source and a hiding source for bacteria. It can block disinfectants from getting to the bacteria. So if you can reduce the scale, you should be able to reduce your risk as well. In addition to the solutions that we've talked about, those are the main solutions out there on the market right now. And again, I stress, not one of them is the best. There are pros and cons to each of them, and you should really look at having a multi-barrier approach where you have multiple solutions. When talking about hospitals and bacteria, I always include a little bit of information about drains. We've actually been hearing a lot more in the industry about drains and the ability for bacteria to actually come up out of those drains. So you need to be looking at your piping and your drainage. What are those things made out of? What kind of materials are they made out of? How are they put together? Are they easy to clean, easy to maintain, etc.? So really take a closer look at that because that can be a source of bacteria, whether it's Legionella or many of the other bacteria. So I always tell you to take a look at that. So again, what we've looked at and talked about is a multi-barrier approach to Legionella. These are some of the solutions, not all of them are shown here, but you need to start at knowing what's coming into your building. You need to have solutions within your point of entry. You need to know and be aware of your premise plumbing system, how the design is, and then you need to look at your point of use. And you need to look at point of use mixing, and you need to look at point of use filters as an option. So again, the best way to mitigate your risk for Legionella is a multi-barrier approach. A few parting words. Next, please. There are things in the healthcare industry in regards to plumbing design that do not have anything to do with Legionella. So I just wanted to end with a few of those things for you. There are a lot of non-traditional healthcare companies coming into healthcare. You're seeing Apple and Amazon coming in. They're bringing new technologies. That hasn't affected the plumbing systems yet, but I would bet that sooner or later, some different things in technology are going to come about within that premise plumbing system. Telehealth is something that's happening a lot of. Our aging population. We have a very strong aging population. There's two things there. We have an aging population as far as our regular population. That means that we have more people with compromised immune systems. The other thing to think about here is the aging of our infrastructure. Our infrastructure throughout the states is old. We're going to continue seeing, I would guess, an uprise in bacteria levels coming from that older infrastructure, so we have to be aware of that. Modular design is becoming much, much more prevalent, especially in patient rooms. And we're seeing a shift away from traditional inpatient facilities. We're seeing more retail operations, more buildings that are built for one specific service. So all of those things are going on as far as the industry in addition to the concerns for Legionella. As far as Legionella, a closing note, again, multi-barrier approach. Know your design and design appropriately. One solution isn't going to fully mitigate that risk. You need to look at a multi-barrier approach with multiple solutions from point of entry to point of use. Next slide. And that ends my presentation today. I think we're going to open it up to any questions or comments.
Thank you, Jenna. It looks like we have a few questions in the chat box. Also, if you like to, Chantal, can you tell them how to ask a question over audio?
Yes, thank you. Ladies and gentlemen, if you would like to ask an audio question, you may press *1 on your touch-tone phone now.
All right. Thank you. Jenna, the first question we have is from Daniel Ostrin. How would you implement scale reduction in the premise building plumbing?
Sure. So there's a couple different ways you can do that. One way is if you have a softening system that uses salt, that can have an effect on the scale that's is or is not building and growing within your premise plumbing system. Not everyone likes to use salt. and it has some negative effects and some things that you need to know about if you do choose to do that. We have a solution called OneFlow that has a media within it. It's called template-assisted crystallization, and the minerals are brought together to form microscopic crystals that then flow through the system, and they don't attach to the fixtures or the pipes or the appliance components. So this technology can help prevent that mineral buildup as well.
Okay, thank you. We have another question from Lin Young. What if you have a break in a water pipe within the building? Are there particular mitigating factors that you would want to put into the place?
So if you have a water break, I think, one, communication is key. So your facility personnel should be communicating with your infection control personnel so everyone knows exactly what's going on. You need to look at, is this only affecting a certain floor, a certain building, a certain unit, and then you can make those implementations to mitigate the risk appropriately. First of all, you would probably be looking at putting those point-of-use filters in just as a precaution.
Okay, thank you. Back to Daniel's question, not scale prevention, but reducing scale already in the plumbing. Do you have a technology for that or a mitigating factor for that?
I'm not for sure. I think that's a very similar question to the one before. You, in addition to having a solution that specifically addresses scale like the OneFlow or a softening system, again, you need to be looking at how your water's flowing, is it constantly flowing, et cetera. But yeah, those would be the main things.
We have another one from Edwin Castro. Any idea how to keep water moving or circulating on a dead leg?
That's a tough one, and I think that's why when I ask what the biggest concern is, usually the answer are dead legs. Unfortunately, there's not a lot you can do about them except to identify them and know that they're there. There might be a possibility that you could eliminate one. Obviously, that means breaking, into your wall and changing the flow of water through new piping. So that's not often done just because of the cost. I would say your number one is to identify them, locate them, and then make sure that you have something down the line from that dead leg in place to help mitigate your risk.
Thank you. We have another one from Dan Marsh. How do you go above 120 to kill without affecting your staff or patient?
So the way that you do that is through mixing valves. So you can run your water at a higher temperature throughout your system, but once it arrives at that faucet or that shower head, that mixing valve automatically takes the temperature down, so you take away the chance of scalding someone.
We have another one by Carrie Corey. What can you do as a patient or staff member independently, if anything, to add a layer of protection?
That's an excellent question. I would say just to be aware of what you see in newspapers. A lot of people are now aware of Legionella where they might have not been before just because of how much press it's getting. So be aware that if you're at risk, if you're in a hospital and you have those, your immune system is compromised, be careful about what waters you could be inhaling. It's interesting too, kind of a side note, more cases of Legionnaires happen in hotels, but more people die from Legionnaires if they've contracted it in a hospital. So just be aware. A simple thing you can do, it may or may not be very effective, but let's say you're just getting into a hotel room, turn your faucet on and your shower on and let them run for a little bit. Sometimes that can help to dislodge anything that might be there if water was sitting or if it had become stagnant. Let those flush out.
Great, thank you. Look like we do not have any other questions, and we do not have any audio questions. Just to all of our attendees, if you'd like to download the presentation, in the resources box above, if you click on the presentation and click the download button, you could download a PDF of today's presentations. Jenna, thank you for providing us a great webinar today. If anyone else has any questions or concern, please reach out to Jenna here. Her email and phone number is on the webinar, or if you like, you can send Ashley an email and we'll get it to Jenna. Jenna, thank you for today. Everybody, thank you for your participation. I feel like we can conclude the webinar.
Thank you very much.
Thank you.
Ladies and gentlemen, at this time, this now concludes today's conference. You may disconnect your phone lines and have a great rest of the week. Thank you.